Scott, let's start, first of all, just talking about where we stand right now with the Delta variant in this country. How bad are things, and where do you think we stand?
Well, look, I think we're further along on this epidemic wave than what we're measuring right now. As I said last week, I wouldn't be surprised if there's 1 million infections a day happening or more. A lot of people are being tested at home with things like the Binax Now, the antigen test. So a lot of the positive cases that are occurring aren't being reported. And to the extent that a lot of the infections happening in people who are vaccinated or younger people who are developing milder symptoms and are less likely to present for testing in the first place, I don't think we're turning over a lot of the cases that are occurring. So if you assume that there's about 90 million Americans who are unvaccinated right now, and maybe about 40 million of them have previously had COVID in other waves of infection that have swept across the country, that leaves about 50 million Americans who are unvaccinated, who are eligible for vaccination. So those are adults, not children, who are eligible for vaccination. If you assume about 15 million of them have already been infected with this Delta wave, you maybe have another 15 million people who are going to end up getting infected with the Delta variant before this stops spreading at the velocity it's spreading right now. And in fact, when you look at what's happening in the South, the RT, which is the rate of transfer, it's still above 1 in a lot of the southern states, which means you have an expanding epidemic, but it's going down, which means the rate of expansion is slowing. And that's pretty directional. It doesn't really sawtooth. It's directional. It goes up, it goes down. So the fact that it's turned the corner and is heading down in states like Florida, Louisiana, Mississippi is a suggestion that the epidemic is running its course in those states. Now, it's still expanding, but expanding at a much slower rate, and hopefully will fall below 1, which means you'll start having a shrinking epidemic.
Meaning we'll be at the height of this in a couple of weeks, or we already are at the height?
Well, it might be petering out in certain states. Certainly Tennessee, where the R has fallen below 1, is one example of a state that had a very dense wave of spread and now has an epidemic that has turned the corner. I think you're seeing signs that it's sort of petering out in some of those states. So maybe another couple of weeks to go. If you think that there's about 1 million infections a day, maybe more than that right now, and you think that there's maybe 15, 20 million Americans who are vulnerable, who are going to end up getting infected before there's enough immunity in the population, before this stops spreading, that puts you on a trajectory for a couple of weeks of maybe continued spread. The problem is that the South really is the epicenter of the epidemic right now. Florida really is the epicenter of the epidemic. And the South will come out of this in a couple of weeks, but you're going to see cases start to pick up in the North. You're already seeing that in New York. Now, I don't think the epidemic wave is going to be anywhere near as dense here because we've had more infection. We have a higher vaccination rate, but you will see cases start to pick up. So it's going to give the specter that we're going to experience a wave of Delta as well, similar to what the South did. And that's going to coincide with the restart of school. So I think it's going to complicate things. This is a big country, so this epidemic wave is going to hit different regions at different points in time. It's not like the UK, where really what happens in the UK is determined by what happens in London. You're going to have very regionalized waves of infection sweep across the U.S., much like with B117 as well.
Hey, Scott, have you seen any data that you think is reliable that indicates that this is a more lethal or more not dangerous, could imply a more transmissible, but anything that shows that the outcomes are worse or the hospitalizations are more frequent with the Delta variant?
Yeah, it's really hard to tease that out. The CDC, the data that was leaked to the Washington Post, that slide deck, if you look at the slide deck, the CDC had a suggestion in there that they think it could be more pathogenic, not significantly more pathogenic than B117, but in terms of where they placed it on the continuum of different viruses, they placed it in a category that perhaps could suggest that it's a little bit more pathogenic based on what they're thinking. I don't understand what the thinking is behind that.
Yeah. Do you think the CDC has relied on any data that has been maybe not completely reliable? And just overall, do you think the CDC is being as effective as it could be in messaging about what's happening? I mean, I don't envy their job, but it's certainly been, I don't know, would you call it questionable, some of the things the way that things have been released or even decided on?
Well, I don't question the ultimate judgment. I think the agency hasn't released bottom line information and really spoken to the public in a way that helps us understand our own individual risk. CDC has a very retrospective mindset. It's a high science organization that does very exquisite analyses. That's not what you need in a setting of a crisis. You need real-time information, actionable information that can partially inform decisions that individuals and policymakers have to make. So waiting 4 months for an MMWR report to come out to tell us exactly how bad the Delta wave was isn't going to be helpful. What we need is real-time information. That's not what the CDC is accustomed to doing, but it's almost antithetical to their culture to put out partially informed information that may end up being wrong, yet that's exactly what we need right now to understand our own personal risk.
Shepard Smith here. Thanks for watching CNBC on YouTube.